Right, today WBAL-TV is taking part in the National Association of Broadcasters National Day of Action. This kicks off the White House's call for all Americans to get the COVID-19 vaccine in the next month. Dr. Farhim Yunus is an infectious disease expert at the University of Maryland and joins us now to get the facts. Let's start off with this. While we're talking to you right now, why is it so important for Americans to get their COVID-19 vaccine shots?
Sure, thanks for having me. I believe we need to understand that the virus has upped its game. It's not just the same virus. There are multiple variants around the world. And right now in Maryland, we are seeing variants first discovered in UK, in Brazil, in South Africa, and believe it or not, even in India. So we, in response, have to up our game. And it's extremely amazing. It's fortunate for us that we have 2 or 3 or multiple powerful vaccines. And that's the right response to a virus which is evolving almost every week, every month.
You use the word response, so let's talk about immune response. Let's talk about antibodies. If we get that COVID-19 vaccine shot, how long will the antibodies last? How long will we be immune to COVID-19?
Sure. So I think we don't know exactly what is that upper limit. Well, we know it's long enough. It's stronger and more robust than natural infection. And more data is now coming out that the Pfizer, Moderna, Johnson & Johnson vaccines are effective against the variants. We don't need to forget what happened in Brazil, where up to 75% of the people had already gotten COVID in Manaus. And then this new strain P1 came and people started getting reinfection. So we need to avoid that. And the best way is, again, to get vaccinated.
And part of that is herd immunity. We talk about herd immunity all the time. As far as you're concerned, when we talk about herd immunity, are we talking about people who got the COVID-19 vaccine? Or are we also taking into account people who caught COVID and perhaps have some natural immunity to COVID-19?
So I think for this year, it's probably okay to combine both of those numbers, but herd immunity is not an on-off switch. It's more like a dimmer. Every person, every faith community, every college, every business, once you get those folks vaccinated, you move us closer to that 70% mark, which typically is talked about. But that doesn't mean that at 69% we don't have herd immunity, and at 70%, 71% we are all made of titanium. It doesn't work that way.
All right, Dr. Yunus, let's talk about some of the things that cause people to be hesitant. A lot of people say, I don't want to deal with the side effects. Let's talk about the side effects, and what can you say to allay anyone's concerns about side effects?
Sure. So I have seen now thousands of people who've gotten vaccine. I've gotten vaccine myself, my family, my 13-year-old. You should expect arm soreness. You can have some exhaustion, some body aches for 1 or 2 days. But here's the kicker. God forbid you got COVID, you could have more severe side effects than that for up to 2 weeks. If you are sicker than that, you could end up in a hospital for 2 months. So these side effects are very predictable. We're not seeing any long-term side effects that are common. And just look at it like the seat belt you wear every day. What are you trying to do? You know that there are 6 million car accidents in America every year. Seat belts reduce that risk of injury or death by 50%. And yet we put that belt, we go with that inconvenience every day. This is just about getting 2 shots. If that's too much, get 1 shot of Johnson & Johnson. But it reduces your risk significantly. We know that these vaccines reduce the risk by 95% or more in terms of severe disease. So the risk-benefit equation is heavily in favor of getting the shot.
Snap yourself into that seatbelt. I appreciate that analogy. Dr. Yunus with the University of Maryland, thank you for joining us this evening.
Thank you for having me.